So often patients are referred to the chest clinic with a cough where we do scans and find out that they have lung fibrosis. Hi, I'm Rama Vancheeswaran. I'm a chest consultant and I've been so from 2006. What is lung fibrosis? So within the lung structure or the parenchyma of the lung, sometimes you get scarring. And this scarring is called generically as lung fibrosis. So often patients are referred to the chest clinic with a cough where we do scans and find out that they have lung fibrosis, or they go through some system like the lung cancer screening system, or they've gone through some other specialty where they've noted that there is scarring in the lung and therefore they're referred to a chest clinic, and specifically an ILD, an interstitial lung disease clinic, for the assessment of lung scarring. Now, this is not a single diagnosis. It is a complex, huge umbrella term for nearly 150 different types of lung scarrings. The most common one is one that often occurs in men called IPF, and that is now not curable but definitely treatable, and one can do more to halt its progression. So that's the commonest one, but it's not it's more present in men than the others, and its treatment is very different to the other types of fibrosis. So the other types of fibrosis are many. You can have smoking related problems, or you can have joint or connective tissue disease related problems, or as in they cause scarring, or you can have types of scarring associated with medications or work. So there are things like pigeon fancier's disease, so people who work with birds can have it, or people who work with various different types of agents, asbestos, various different of baker's dust, and there's so many different versions of lung scarring. So an employment history is really important, and if you think it's that type of scarring, avoidance of the trigger or the cause of that problem can result in it either not progressing or reversing. Infection can come and go, but it can leave scarring, and that can be called something called organizing pneumonia. So that's another type of scarring. And then comes things like granulomatous lung disease, which are things where there's no clear cause, but they are treatable. So apart from the IPF, which is a purely fibrotic condition where there are medications for it, the other types of conditions can be treated with anti-inflammatories, which is like steroids or other immune suppressants, and avoidance of the identified trigger. Now, all of these conditions can all behave like they're progressive and untreatable if they're not recognized and not managed. So it's so important to take a history which is so detailed, because it would need 10 years worth of work, medications, progression, symptoms, signs. So we need to know whether they've got any arthritic or inflammatory bowel related type things, or other conditions that may be associated with scarring. So it's an extensive history, and then an examination. The examination also is terribly important, because your hands can tell you something about the type of scarring one has. Say, if you look at someone's hands and they've got rheumatoid arthritis, it might tell you it's a rheumatoid problem that is there, and it can be arthritis related or the medications associated with rheumatoid arthritis that cause the lung scarring. So huge causes that can be picked up from examining. And then when you listen to the chest, you get different types of noises. You get little tiny squawks, that would suggest hypersensitivity or broncholytic process, which is an allergic type of lung disease, or a hypersensitive lung disease. Or you can get the straightforward crackling, which sounds like, they call it Velcro crackles. If you take your hair and rub it around your ears, you can hear that type of fine crackling. So different types of noises. And that is followed by a scan, then a lung function test, because we want to know impairment and progression. And then you may need to have both a biopsy or a wash of the lung, because when you wash the lung under a sedation, which is just a day procedure, we get a profile of cells, and if they're much more reversible, they're lymphocytic or eosinophilic, we can treat it easily. However, if they don't have any type of profile, it might mean they're more fibrotic. So the wash is important, and a full set of bloods to look for the arthritides and other allergic type inhaled agents are important to give you the blood stuff. And then once we've got all that information together, we discuss it at something called an MDT, where there are radiologists and pathologists and clinicians, and we put it all together, and that enables the accurate diagnosis of the interstitial lung disease. And once we know what that is, we can start treatment. It's either purely fibrotic therapies or avoidance and anti-inflammatory therapies, and then follow up. So complex, but very, very doable, but one needs to get the right, the timing right, because the earlier a patient presents, the quicker it is to either reverse or hold progression of the condition.